Good morning. I am Dr. Sai Ravi Shanker. I am the HOD and Senior Consultant Cardiologist, Pratima Hospital, Kukatpalli. Today we will discuss about the cholesterol management and its understanding. Before that, I just want to tell that cholesterol is the essential component of the blood cell and the tissue. Almost every cell of the body needs cholesterol to function. The normal cholesterol is essential in producing the hormones, vitamin D, bile and digestion of the fat. So one of the important component of the body is cholesterol. So too much of cholesterol is bad, which will aggravate to the atherosclerosis and cholesterol deposited in the blood cell, which causes clot and heart attack. If it is deposited in the blood vessel, it causes heart attack. If it is deposited in the brain, it causes brain stroke. If it is deposited in the lower limb, we call it a peripheral artery disease. So there are cholesterol is in fatty in nature and cannot dissolve in the blood. So there are different types of cholesterol. Out of that, few are good cholesterol and few are bad cholesterol. Let's talk about the bad cholesterol. Bad cholesterol, one of the important is the LDL, low density lipoprotein, what we call is a bad cholesterol. As it carries cholesterol to the tissue, including the blood vessel, most of the cholesterol in the blood in the form of LDL. So this LDL level again depend upon the patient to patient. If the patient is having ASCVD risk score is high, or that means if the patient is already having a heart attack or peripheral artery disease or a cerebrovascular accident, for that patient LDL cholesterol should be maintained around 55. For a risk factor like diabetes and two or more risk factors are there, then cholesterol level should be maintained around 70. For a normal individual without any risk factor, if the cholesterol is around 100, nothing to worry. So if there is too much of cholesterol, LDL cholesterol in the blood, some of the excess buildup will causes atherosclerosis and formation of the clot. So that we have to avoid it. Second form of is the triglyceride. So this triglyceride is one of the bad cholesterol, which is a very predominant in the Indian population. South Asian or Indian population, triglyceride levels will be higher. And specifically Indian diabetic triglyceride level will be more. Again, that depend upon the patient to patient. If the patient is having too much of triglyceride, then we have to find out whether it's a familial triglyceridemia or not. If it is triglyceride level more than 500, then we have to target the triglyceride and bring it back to normal. So triglyceride and LDL are the bad cholesterol. Then we will talk about which is the good cholesterol. Good cholesterol is high density lipoprotein. That is what we called HDL. As it removes the bad cholesterol from the various organ and clears it from the body, it can also remove excess cholesterol accumulated in the blood vessel. So that is the reason HDL means high density lipoprotein is the good cholesterol. HDL, H means healthy cholesterol. So good cholesterol or healthy cholesterol. So in what way we can increase the HDL level means good cholesterol? The best way is to do regular exercise. And few of the medicines available also niacin, but I recommend to do regular exercise to improve your good cholesterol or healthy cholesterol. These are the two bad cholesterol and one good cholesterol. There are one more is VLDL, but just remember LDL, triglyceride and good cholesterol HDL level. These three are the important for us. Or we indirectly tells that non-HDL cholesterol means all are bad cholesterol. So again we have to calculate how much total cholesterol, which is the total amount of cholesterol in the blood based on HDL, LDL, triglyceride. That depend upon the how much HDL and non-HDL level. As I have told, these levels differ with the different person to person. So a lab report, a printed one, it will be a misinformation to the patient. So better if the levels are high, better to consult a doctor. So drugs, if it is high, we have certain drugs, and most important and most commonly used drugs is the statins. We have different varieties of statins like atorvastatin, rosuvastatin, pravastatin. These statins will reduces the LDL, these statins will reduces the triglyceride, and this statin will increases the HDL level. Second drug is bile acid sequestrin. Third one is a nicotinic acid, and fourth one is a cholesterol absorption inhibitor. And another is ezetimibe. If the LDL level is too much of high, then we have a recent drug with the injectable form which can be given twice in a week, apseximine. We have in the form of Rapata, which is available in the Indian market. So it can be given twice a week if the LDL are too much of high, in spite of giving all the normal cholesterol drugs like statin, ezetimibe, whatever XYZ drugs. So how to decrease the cholesterol level without medication? So most important is the lifestyle changes. How? Healthy eating is an important thing. The cholesterol part, if you eat whatever the junk foods, fast foods, these foods increases your LDL level. So better to avoid junk food and fast food. Limit the food which is having high saturated fat. Choose food with low saturated fat, with low trans fat, which is a very important thing, and reduces your salt intake and added sugar, avoid it. So eat food which is naturally having high fibers. These fibers will reduces your bad cholesterol level. Second is, first is which I have told about diet. Second is, most important is the physical activity. A minimum physical activity of 45 minutes per day, 5 days in a week, that will increases your good cholesterol and decreases the LDL and triglyceride level. So this two. And third, if you are having a smoker, you can quit smoking. If you are obese, please see that your BMI level should be less than 25. These are the, and too much of stress also causes cholesterol level to increase. So reduce as much as possible the stress, and proper sleep is also essential to maintain the cholesterol level. So if you maintain all these things, your cholesterol will be absolutely normal and you will have a healthy heart and healthy body. Thank you.